For runners with asthma like me, an important part of running is knowing how to catch your breath again after running. You may have heard in PE class as you were growing up, oh, it's better to breathe with your hands above your head, or it's better to breathe with your hands on your hips, or it's better to breathe with your hands down on your knees. So which one is it? Well, I'm Dr. Christina, the Picky PT, and I'm going to tell you today how to be picky about how you catch your breath again after running or any kind of physical activity where you're out of breath. If you like this type of topic and you want to learn more about your own body, make sure to like and subscribe to this channel before I continue on with this video. So, as a physical therapist who is a runner and I love doing cardio exercise, but I also have asthma, it's very important to me knowing how to catch my breath again after running. A specific technique that we take from pelvic floor therapy actually is recognizing that 360 breathing is going to be the way to engage the most lobes of your lungs and get the most air in as you're trying to catch your breath again. So, in the instance of breathing with your hands overhead, what you may notice from the side view is that as I do that, my ribs lift up a little bit and maybe point out. We call this flaring your ribs. When I do that, it makes it much easier for me to breathe into the front of my chest, but notice I'm not really getting a whole lot of movement in the back of my thoracic spine. So instead, in order to get more of the lobes of my lungs involved, I prefer to have you breathe with your hands on your knees. When you're in this position, you can engage your lower abdominals by pulling your pubic bone towards your belly button, which will lengthen your back and make it easier for you to open up your back and your sides as you're breathing in after an activity. So when you 360 breathe in this position, it's going to look like this. A couple of things to consider with this type of breathing though. You do not want to allow your shoulders to rise up as you're breathing in, so it shouldn't look like this. You also want to make sure when you're exhaling, you're tightening your core even more so it drives the air towards the back of your lung lobes rather than allowing all the air to come forward like you normally breathe when your hands are overhead. So as I exhale each time, you'll notice that I pull tighter into my core. Instead of what I don't do is drop down into my stomach as I exhale. Hopefully these breathing techniques help you to catch your breath more after you're done running or doing any type of cardio activity. If you try these out and you're struggling with getting the air into all of the lobes of your lungs, into your sides, into your back, and you find that you're still just belly breathing or breathing into your front of your rib cage, make sure to make an appointment with a pelvic floor specialist and a neuromuscular expert, a physical therapist like myself, who can go ahead and teach you drills and techniques on how to use your core muscles correctly to help you expand your ribs fully and then tighten your core as you exhale to make the most efficient breath in and breath out possible.